I run a program in the Northeast where we have seen thousands and thousands of young girls and women, as well as men that have been affected by the conflict in the Northeast. At first, when we go to those communities, it's not very apparent in the first instance the need to address these mental health challenges, because what we find is that when we go, people seem to be sort of more in need of food, water, shelter, which are the basics and very, very necessary. However, no matter how much you eat and if you have a roof, a shelter, when you go back to sleep, you're alone suffering with those nightmares and recalling the traumatic experiences that you've been through, with nobody to speak to about it, who understands what you're going through, your sort of internal reality. So we see that when we get these people to come to talk to counselors and psychologists, there's always a very huge relief. At the end of the day, that's not always apparent at the beginning of the exercise. If you look at the statistics, for instance, our framework for provision of mental health and psychosocial support in Borno State has just been developed. And in it, there's the statistics of the number of psychologists and psychiatrists in the state that has thousands and thousands of people affected by the violent insurgency. Actually, millions of people that have been displaced from various parts of the Northeast, from various states, various local government areas, various wards. And the number of psychologists in these various states are so small, they're less than a drop in the ocean. When you think of states, or a state as huge as Borno State, it has several people that need these services, and you have less than 10 psychologists and even psychiatrists put together. That gives you sort of an idea of the extent of the problem.